ODI Clinic presents Doubt, Search, and Truth. The cultural heritage of Mongolian traditional medicine from an ancient historical time was left written in the books and chronicles, but also was inherited from the teacher to disciple, heart to heart, and through word of mouth among the families and training of medical practitioners. The senior physician asked his disciple to follow him as an apprentice for many years, during which he was introduced to medicinal herbs, instructed in preparing pharmaceutical prescriptions, and trained and diagnosed through the pulse in order to heal patients. Such a gifted doctor and teacher was a great professor of the 8th generation of Mongolian traditional medicine practice. Dr. ODI was a successor of those Mongolian traditional medicine arts. Teacher ODI, who was enlightened in Oriental and Tibetan medicine, treated medically and healed the suffering secretly as he was able during the period of despotic socialist ideology, when traditional medicine was suppressed and hampered. But even then he was an uncommonly savant person, respected by the people as a legendary Samaritan. He cured a cancer in his own lung and stomach personally, which produced much admiration among his medical followers. Dr. ODI's followers, Dr. Terendorch, Dr. Alexander, and Dr. Batar, have founded the Mongolian Clinic of Traditional Medicine and named it ODI Clinic. So they immortalized the sacred memory of their merciful teacher and carry on his benevolent activities. Dr. Batar, who has inherited much knowledge, skill, and more than 400 secret prescriptions from his teacher, he has also earned noble merits by treating and healing dozens of patients whose diseases were diagnosed as second or third stage malignant tumors resulting from metastasis, which modern medicine considered as incurable. Dr. Batar graduated from a contemporary medical university, but he is a doubly knowledgeable doctor because he learned and worked with his traditional medicine teacher as an apprentice for 12 years, which he practiced traditional medicine for more than 10 years. Before talking about the treatment and cure for malignant tumor by traditional medicine, let's see how the Oriental and Western medicine considers the patient and illness. Western medicine considers man to be formed from basic organs such as bone, muscle, vessels, sinew, blood, and liquid, but Mongolian medicine explained them according to the theory of 5 elements and not everything separately, since human organs are reciprocally related and also mutually dependent on each other. The relationship resembles that of mother and son, comrade and enemy, or like elements such as fire, earth, iron, water, and wood. The heart and small intestine have the fire element, the stomach and spleen possess the earth element, and long and large intestine have the iron element, the kidney and bladder have the water element, and the liver and bile have the wood element. Liver and bile are the mother for the fire of the human heart, while the small intestine creates heat and energy. Their son organs are the stomach and spleen, while their enemy organs are the kidney and bladder. Treatment methods of Western and Oriental medicines are different due to their basic conceptions. Western medicine treats the heart when it's in pain and the kidney just when it's sick, and there are specialized doctors for each organ such as the urologist, the cardiologist, and the otolaryngologist, etc. Nevertheless, in order to treat the heart, traditional medicine first tames its enemy organ, the kidney, and support its friend organs, the liver and its bile. This way it treats and heals by balancing the air, jaundice, and mucus. The air, jaundice, and mucus were born together with man. Air is in the lower part, jaundice is in the middle part, and mucus is in the upper part of the human body, respectively. Traditional medicine gives the periods of season special importance, and while it gives one medicine to kidney in the winter season but another medicine in summer, Western medicine gives the same medicine to kidney irrespective of the season. However, although the basic conceptions, methods of treatments, and technologies of Western and Oriental medicines are different, one should not consider either particularly superior. Traditional medicine is not limited to 5 elements, and it's a great science of which it's impossible to research perfectly and to study everything in order to reach its summit. The dangerous disease of cancerous tumors constantly threatens mankind and reaches even into the 21st century. Scientific medicine can't find better methods other than chemotherapy, radiation therapy, or surgical excision of an organ or part with cancer. Malignant tumors considered hopelessly incurable by Western advanced medicine have been affirmed to be curable by doctors of Mongolian Traditional Medicine Clinic, ODI. There is no other way to recognize that the people recovered by the prescribed treatment of Mongolian traditional medicine, but to see them alive with all organs and safe and sound for anywhere from 3 to 20 years without being poisoned with chemical or radiation therapy. It's very similar to the two concepts that the traditional medicine interprets the tumor is a concentration of cells complaining to their owner, while Western medicine explained that the tumor is healthy cells that have changed and grow as unhealthy cells. Since one's formulation regarding to the conception of cancer is vitally important, what's the consideration of traditional medicine concerning a malignant tumor? So, above all, Mongolian treatment for cancer is mainly in accordance with the theory of Lunde Batam Sunai. It's a rare accumulation, which means it holds a basic theory that any disease accumulates, concentrates, and then whirls up. For example, in the liver disease occurs where air is accumulated intensively along with an accumulation of jaundice, so that accumulation of jaundice whirls up there. In the disease of mucus, there is an accumulation of cold, so human body organism is a big, whole complex system, while time is also another big system. The balance of these two large systems, the weather of the 4 seasons and human body plus related medical treatment, creates a base of diagnosis and medical treatment. It's determined that the malignant tumor is composed of complaining or upset cells. For example, the definition is that these liver cells have complained against their owner, and scientifically it's referred to as a concentration of cells. It seems ridiculous if people are told this and the scientific community won't recognize it at all. But indeed, the owners often offend their cells or misinform them. Harmful things are mentioned, but on the contrary, our cells must be protected even though too much is eaten or hunger is experienced, alcohol or tobacco products are abused, and also cells are offended by consuming various other kind of poisoning products until they cease defending our bodies. The anomalous objection further automatically creates concentration and whirls up of cells, which is the initiation of cancer. In order to diagnose successfully, it's necessary to balance the closely connected and mutually relating 3 main factors, which are body, mind, and soul. Then to carry out the treatment coordination in full concordance with the weather of 4 seasons and also the 5 elements, 7 vigors, and 3 extents, then it will be possible to prevent this man from cancer. Their circumstances to cure the disease of malignant tumor are basically to tightly relate this system with weather conditions, while the main meaning of the treatment is to carry on without losing time, considering the results of the analysis of highly sophisticated imaging apparatuses and laboratories of Western modern medicine. Dr. Batter has participated in such international events as the International Conference of Traditional Medicine in Ulaanbaatar 1996, the International Seminar of Ulaanbaatar for Mongolian Traditional Medicine 2001, the International Congress of Kokhuat of Inner Mongolia, and has interchanged his opinions and thoughts between international scientists. He has invited and visited South Korea, Inner Mongolia, Thailand, Singapore, and Buryat, Mongolia to treat many sick people and has healed them. He worked as a doctor for the famous American movie star Steven Seagal of Hollywood, and he is highly esteemed by many people of different places for his kindness and noble deeds. Clinicians of ODI Hospital organized a conference of scientific research, taking their work experience of many years and studies of patients whom they have healed as a basis. Their lecture reported that traditional medicine can cure malignant tumors, but their speech has astonished some scientists, and some have been doubtful to the point of denial. These folks cannot concede their proof at present, but medics of ODI Hospital totally believe that they can study, discover, and develop the magic of Mongolian traditional medicine at the level of modern medicine. A malignant tumor has a quick process, and people with such diagnosis were predicted to live only 3 to 6 months. But people whose diagnosis was confirmed as incurable cancer were treated medically by Dr. Batter, and 22 of 34 people, or 61.7% of them, were healed completely. Such a high index of cancer treatment still is not observed in a highly developed Western medicine. The diagnostics of modern medicine has proved that malignant tumors treated by Mongolian traditional medicine have disappeared. ODI Hospital establishes controls for 3 years after registering a patient, and if a person lives healthy for more than this term, it's considered to be healed. First, I had been very fatigued for some time and had a hole in my pelvic part. It was difficult and I became bedridden, but at the 20th day, I got up and felt good. And after about 40 days, we went back to see our doctor, and he said, go back to check yourself with the echo ultrasound apparatus again and come back. Then we went back to the oncologic center and checked with the echo apparatus ultrasound. And then the physician there was very surprised, asking us if that had been a malignant tumor, and we were asked who was our physician and how does he treat you, etc. We were as if under some kind of interrogation, and finally were told that analysis doesn't look like a cancer. Patient Sukrakchat's story, written after the analysis of the echo apparatus made in the second clinical hospital on April 24, 2007, was that there was a pileup in the 4th, 5th, 7th, and 8th segments of the liver. The clinical physician diagnosed that it's a cancer by analyzing that it originated in a hardened liver and stomach cavity had excessive liquid. Thus, Sukrakcha had a horrible incurable disease, so he heard, and he took the medical advice of Dr. Batter. He was admitted to ODI Hospital, and they have healed him by treating with medicines such as Stanchin, Namji, Gurgum, Enuril, OU25, etc., which they manufactured in accordance with traditional medicine prescriptions, and he was kept on a special diet. He who had an incurable disease now is living a healthy life. This presented note was written by a man whose name is Janchev. His sickness began in December 2000, and computerized tomography scan revealed that there was a very clear cyst at the right side of the abdominal cavity, and determined that it could be an echinococcal cyst of the abdominal cavity. So he had an operation with that diagnosis, and about a 1-liter sized cyst-like growth was taken off from his stomach cavity and sent for histological analysis, but the diagnosis was not determined. 2 months after that surgery, fluid collected again, and he was operated again in the oncology hospital, since cancer was now suspected due to the recurrence.